One of the big trends we're seeing in population health is, again, embracing data and in order to better understand populations and even micro areas within the larger population, to understand where are the areas that are in the most acute need and what are the specific needs of those areas, and then how do you then deploy services into those areas to then achieve the best results. So typically in population health or a lot of factors in healthcare with health systems, there's a lot of macro level data. In this city, in this county, there's X amount of these things, or there's a lack of these things. But if you think about any county in the United States, any major city in the United States, where do I start, right? And so using analytics, getting down to household level information, leveraging that with healthcare data, leveraging that with retail data, consumer data. There's a number of things that are out there, mobile data, a number of things that can really help identify micro areas that need services and what specific services do they need, and how do you talk to those people in that area to either let them know that you're now offering this service in this area and why that's important, education initiatives. But if I'm a health system or I'm any health business and I have to educate an entire population about something, it can get extremely expensive, more money than that system reasonably has to address those issues. So how do you use analytics to get very micro and focus on the highest areas of need, and then know specifically what's needed there and how to go get those outcomes? And then also use analytics to measure how well you're doing, testing and learning and getting smarter over time. It has to be a continual investment and devotion into population health and improving those outcomes. And that means not just attacking an area with something once and then thinking that it doesn't need to continue to be tweaked or added to or measured. Is it working? Is it not? Do we need more things here? Do we need to take things out of here and put it here? How do we do that and embrace analytics to test and learn and get smarter over time? Because the fact of the matter is, no matter what healthcare legislation gets passed, changes, gets put in the future, right? We're not going to win this battle unless we get people healthier, right? You can treat a bunch of sick people, but that if we only focus on treating you when you're sick, we're never going to win, right? So we have to say, how do we not just treat you when you're sick? Yes, we're here to treat you when you're sick, but how do we keep you healthy? And how do we establish a relationship with you? It sounds heretical sometimes, but a brand with you, a relationship with you if I'm a health system. How do I create a brand with you as a consumer so that you have a cradle to grave relationship with me? I am there for you in all of these things. I'm helping keep you healthy. I'm making you stronger. I'm making you better. Every step of the way, we're invested in your good outcomes of health. That's going to give us a chance to have much better health outcomes. And that's what population health is about. But you can't just spray and pray and throw a bunch of money at a problem inefficiently. You have to understand how to specifically address things in very micro areas. And I think the embrace of analytics beyond traditional healthcare analytics, really leveraging demographic and consumer data and other ways in which to understand people better, that's a big trend that I think is going to pay a lot of dividends.